Welcome back. We've all heard the most recent COVID surge is putting an immense strain on West Virginia hospitals, but what does that mean and what does it look like? Well, WVU Medicine recently gave us exclusive access inside one of the busiest COVID ICUs in the state. Now, before we bring you this important story, we want you to know a few things. Under ordinary circumstances, most hospitals would not grant this level of access, nor would we seek it. The extreme seriousness of the situation led hospital officials and us to come to this conclusion. This information needs to get out to the public. While in the COVID ICU, our staff did not go into any patient rooms and did not interfere with their care. Prior to this airing, WVU Medicine officials reviewed all of our footage to ensure patient privacy. With all of that in mind, Don Gray takes us inside the local ICU at Ruby Memorial Hospital in Morgantown.
On a recent day, this was the only open room in the medical ICU at WVU Medicine's Ruby Memorial Hospital in Morgantown. With a waiting list stretching around the state and beyond, the room, like every other one in the ICU, would soon be home to a very ill COVID-19 patient.
Adult code blue, 8 southeast. Adult code blue, 8 southeast.
So adult code blue is where there is a respiratory arrest, meaning someone's in extremis, unable to breathe or oxygenate adequately, or their heart is stopped. 8 Southeast is our COVID floor. So right now what you're hearing is a patient who has reached the limits of what they can do with either BiPAP or high flow, and they're putting them on mechanical ventilation. And whether that's a young person or old person, they're in for a long road.
An ICU full of COVID patients isn't just a Morgantown problem. It's affecting hospitals on varying levels all around West Virginia and the region.
Oh, from all over. I mean, we've had multiple patients all the way from Bluefield. Right? You got to remember, Bluefield now is essentially just a little freestanding emergency room. But they're actually acting as a hospital now, holding patients there, 48, 72 hours, sometimes longer. And all they have is an emergency room. But Bluefield, Berkeley, Beckley, Pleasant Valley, Tays Valley, Greenbrier, Wetzel, they're coming from all over. And part of that is because some of their normal referral places are also full, right? So Wetzel would usually go to Reynolds or to Wheeling. Well, Wheeling also is working really hard, and they have a very sophisticated ICU, but they're now in their 3rd level of expansion of ICU overflow. And they only have so many nurses and physicians too, right? So as those places get saturated, then we can't offload the small hospitals with the really limited resources. And that's where things are. Not to mention, on the back end, the skilled nursing facilities are either full or closed for various issues, and all the long-term acute care facilities where a patient could go for a gradual wean off the ventilator once their severe illness is rectified are completely full. So there's no place for them to go.
We've been hearing from Dr. Allison Wilson. She's one of a few medical professionals in the state who help decide which patients get moved to different levels of care from hospital to hospital.
And one of the biggest challenges that we have in West Virginia is that we don't have a whole lot of large, expansive, or tertiary care centers. And so we really rely on our community hospitals, and in particular the critical access hospitals, to be able to provide initial care for evaluation and stabilization. The state for a long time has relied then on the ability to be able to get patients out of those critical access hospitals and get them to larger community hospitals such as UHC or Berkeley, and then eventually, if they need tertiary care, get them onto the larger centers such as WVU at Ruby or CAMC.
Getting patients to the level of care that they need is taking time.
Being able to get those patients to the higher level of care has been encumbered in what used to be a couple of hours is now sometimes 3 to 8 days.
While patients are in the smaller facilities waiting for rooms to open up at larger hospitals, there are challenges. Dr. Wilson says that some of the older facilities, like Braxton County Memorial Hospital, were built with smaller oxygen pipes, never intended to care for patients over a long period of time. Meanwhile, Wilson says that at Camden Clark Medical Center in Parkersburg, the demand for oxygen has caused issues keeping that building system properly pressurized.
So we have gotten to the point, not only, well, throughout the whole state really, of really overwhelming the local resources. And I think the brunt of it is really felt on the front end at the small critical access hospitals and small community hospitals. I mean, God bless them. They're working extra hours with very limited staff trying to do the best they can.
And Wilson tells us the issues with hospitals are not just affecting COVID patients.
I hear people say, well, you know, if the people chose to get unvaccinated or stay unvaccinated, then they made their choice, right? But it's not true, right? Only 50% of the people they're calling to transfer are COVID patients. We have a lot of other patients who this is affecting. The dialysis patient, the heart failure patient, the trauma patient, the stroke patient, the heart attack patient. There's really no one who's getting an ICU bed anymore out of caution. Right? All those patients, we're now not able to offer that level of care. Not just here, but at any of the big centers. And it's really every one of these patients have at least one organ system that's failing, and many of them have multiple organ systems that are failing.